AP 120, Lab 5, topics Axial Skeleton. So, we're going to start off by talking about the structure of a typical long bone. We'll start with, you can cut the long bone into three pieces. You have the proximal epiphysis at the top, the distal epiphysis at the bottom, and then in the middle is the diaphysis. There is a tissue covering, a dense connective tissue structure that surrounds the bulk of the bone surface called the periosteum. And then on the inside, lining the inside spaces of the bone, is another dense connective tissue structure called the endosteum. You also see that the compact bone is the type of bone tissue found toward the surface of the bone, so it is closest to the surface, most superficial. When you look at the epiphyses, you also see that there's a significant amount of spongy bone. Spongy bone tissue is dense, is deeper, and has lots of extra spaces. You'll also notice in the epiphyses that there is these tiny structures here. These tiny structures are called epiphyseal plates in children, and then they'd be made of hyaline cartilage, and they're called epiphyseal lines in adults, and then they're calcified. On the smooth surfaces of the bones, where they come together to form synovial joints, you can find articular cartilage, that is hyaline cartilage. And then all within the nooks and crannies of the epiphyses, you'll find the red bone marrow, which produces all the blood cells in a process called hematopoiesis. All right, when you get down to the diaphysis, there is a open space in the center called the medullary cavity, but it's not empty, it's filled with yellow bone marrow. And yellow bone marrow is mostly made of adipose tissue and is storing triglycerides. Here is a wedge model of a piece of bone in the diaphysis. We see that the compact bone toward the surface has this repeating structure, this concentric rings around a space, and that structure is called an osteon. That space in the center is called the central canal, and the central canal runs the length of the bone and is where you'll find blood vessels and nerves. And then each of the rings, each layer of bone tissue making up one of the concentric rings, is called a lamella. So each one of those sheets of bone tissue is a lamella. In the spongy bone tissue, we see that it does not have the osteon. Instead, it has these girders or connecting structures called trabeculae. Here is the compact bone model. And when we look at it, we can see the central canal. The entire structure here is an osteon. Each layer of bone tissue is a lamella. So there's a lamella, there's a lamella, there's a lamella. The little open spaces are called lacuna. And those open spaces are where you'll find osteocytes. So these angry red eyes are osteocytes. The axial skeleton is made up of the bones along the midline, and this includes the skull. The skull has 22 bones, which you can sort of see in this cartoon structure. There are 5 important sutures you'll need to know the names of. There's the coronal suture between the frontal bone and parietal bones, the sagittal suture out on top between the right and left parietal bones, the squamous suture between the parietal bone and the temporal bone. Turns out there are 2 squamous sutures, a right and a left, and then the lambdoid suture between the occipital bone and the parietal bone. The temporal bone has a lot of special surface features that you need to know the names of. There's this opening here called the external acoustic meatus. Inferior to that is this rough patch of bone tissue called the mastoid process. Anterior to that is a thin piece of bone jutting out called the styloid process. Then we have this bit of arm tissue, bone tissue here, this little arm sticking out. That is called the zygomatic process. And then this little depression here is called the mandibular fossa. And the mandibular fossa, as you can see, fits the mandible in. Here is the mandible. The mandible has this bit of bone tissue called the mandibular condyle, fits into the mandibular fossa of the temporal bone, and this is the only movable joint in the skull. The right and left of these make up the movable joint that lets the mandible move so we can chew and talk and stuff. All right, here's anterior view of the skull. We can see a little bit of the ethmoid bone in the orbits. We can also see the ethmoid bone making up the superior portion of the bone structures inside the nasal cavity. And then below that, this thin piece of bone is the vomer. And then these two bones sticking out on the lateral walls are the inferior nasal concha. For the ethmoid bone, this bit of bone tissue here making up the superior part of the nasal septum, that is called the perpendicular plate. Here is a view of the skull where we cut off the top of the skull to look down into the cranial cavity. And toward the front, here in orange is the frontal bone, in pink here is the ethmoid bone. The ethmoid bone has two structures important here. This pointy bit sticking up, that is the cristogalli, and then the bone tissue surrounding the cristogalli, that is the cribriform plate. Here's an inferior view of the skull, and with the mandible removed, and we see in blue these two bones here are the palatine bones. Right and left palatine bones help make the posterior portion of the hard palate. Up here in yellow is the maxilla bones, the right and left maxilla bones, and they have a structure called the palatine process. Palatine process of the maxilla bone articulates with the palatine bone, and this is the hard palate. The maxilla and palatine bones make the hard palate or roof of the oral cavity. Down here in purplish is the occipital bone. Occipital bone has a large hole called the foramen magnum. The spinal cord passes through the foramen magnum. It then has these two smooth rounded knobs on either side. These are the occipital condyles. They articulate with the vertebral column. Here again is looking into the cranial cavity with the top of the skull removed. This pinkish bone here is the sphenoid bone, and it has a large dip or depression here called the sella turcica. So that is the sella turcica of the sphenoid bone. Here's a mid-sagittal section of the skull where the skull has been cut in half, and it allows us to see some of the sinuses. So here's the frontal bone. This space here is the frontal sinus. Down here is the sphenoidal sinus. You only see sinuses when you cut the bone open. All right, moving on to the hyoid bone. The hyoid bone is not part of the skull. It helps to form the superior portion of the larynx, and the hyoid bone does not articulate with any other bone. It does not form a joint with any other bone. Here is a vertebra. This will be our generic vertebra. So in a generic vertebra, so almost all vertebrae possess a large chunk of bone called the body. They all possess an open space called the vertebral foramen. The spinal cord or spinal nerves pass through the vertebral foramen. Sticking out laterally are these bony structures called the transverse processes. Sticking out posteriorly, this thin piece of bone tissue is called the spinous process. Then we have a small piece of bone sticking up superiorly called the superior articular process, forms a joint with the vertebra above. And then we can't see it, but below is small bony processes sticking down called the inferior articulating processes. They articulate with the vertebra below. All right, the vertebral column has 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar vertebrae, a sacrum, and a coccyx. These are the bones of the vertebral column. You can also see these little holes. These holes are called intervertebral foramina, or one intervertebral foramen. And that's where the spinal nerves come out of the vertebral canal. Now to remember the numbers for these 3 categories of vertebra, we have 7, so breakfast is at 7, 7 cervical vertebra, 12, lunch is at 12, 12 thoracic vertebra, dinner's at 5, 5 lumbar vertebra. The cervical vertebrae, they all possess holes called transverse foramen. So the transverse foramen are within the transverse processes of the cervical vertebra. The first cervical vertebra is called the atlas. It doesn't have a body, it doesn't have a spinous process, but it does have important facets for articulating with the occipital condyles of the occipital bone. And it's very important because it is C1, is the first vertebra of the vertebral column. Then we have C2, also known as the axis, the second vertebra. It has this additional structure called a dens. This bony structure sticks up superiorly and articulates with the atlas, providing a pivot joint so that we can shake our head no. So again, this is the axis. All right, for the thoracic vertebra all form joints with ribs. So they have extra smooth facets on their transverse process and their body where they articulate, where they form joints with ribs. And then the lumbar vertebra is the biggest of the vertebra, has nothing that we've talked about with the others. No extra spaces, no extra facets. The sacrum, that nice triangular bone, and inferior to that is the coccyx. And that is the end of the vertebral column. And this brings us to the thoracic cage. Thoracic cage has as its interior bone the sternum. The sternum has three pieces: the manubrium, the body, and the xiphoid process. So superior to inferior, manubrium, body, xiphoid process. Then we have 12 ribs per side, so 12 right ribs, 12 left ribs, for a total of 24 ribs. The first 7 ribs on any side are referred to as the true ribs because they form a cartilaginous joint directly with the sternum, so they attach directly to the sternum. Then ribs 8 through 12, they are called the false ribs. False ribs because either they attach to the cartilage of rib 7 or they don't attach at all. And then ribs 11 and 12 are also known as floating ribs because they don't attach at all to the sternum. So 7 true ribs, 5 false ribs, 2 floating ribs. And then, of course, the cartilage attaching to the sternum is known as the costal cartilage. Here is a rib attaching to a vertebra. You can see how it has 1, 2, and when the second vertebra shows up, 3 places where it attaches to vertebra. So one rib makes contacts to vertebra, this one and the one above it, at 3 locations: 1, 2, 3. And that is it for this part.